In a primary assessment, you've learned how to apply the cycle of care to ask 2 initial questions when someone is in need of emergency assistance. Is the patient's airway open, and is he breathing normally? When a responsive and conscious patient is choking, they neither have an open airway nor are they breathing normally. A choking patient needs immediate help to restore breathing. In adults, the most common cause of choking is food. Let's learn how to help a conscious and unconscious patient expel an object that's causing him to choke. If you believe a person is choking, begin with scene assessment. Stop, think, and act. Since you're not likely to have contact with body fluids and time is important, you usually do not need personal protective barriers. Ask a responsive patient,
"Are you choking?"
If the patient is coughing, wheezing, or can speak, encourage the patient to cough until he expels the object. If the patient cannot speak or breathe, give the responder statement and alert emergency medical
"I'm an
services.
emergency responder. May I help you?" "All right, take it easy."
After the patient indicates he wants your help, a nod will do. You may use back blows, abdominal thrusts, or chest thrusts to attempt to dislodge the object. Techniques for handling a conscious choking patient vary internationally. Your emergency first response instructor will teach you the techniques appropriate for your area, and it's those you should use when assisting a choking patient. In general, however, there is no clear evidence that one technique is better than another, but there is evidence that if one technique does not help a choking patient, then another one might. To deliver back blows, take a position to the side and slightly behind the patient. Supporting the chest with one hand, lean the patient forward. Next, firmly strike the person between the shoulder blades with the heel of the other hand 5 times. Stop if the obstruction clears or move on to another technique. Abdominal thrusts use residual air in the patient's lungs to blow the obstruction clear. Stand behind the patient with your arms around her waist. Find the patient's navel with one hand. Make the other into a fist and place the thumb side against the patient's abdomen slightly above her navel, like this. Put your other hand on top of your fist. Bowing your arms so you don't squeeze the patient's ribs, pull your hands inward and upward in a thrusting motion. Stop if the obstruction clears or move on to another technique. Abdominal thrusts may not be possible with some individuals, such as those who are pregnant or markedly obese. In these cases, provide thrusts in the center of the chest. Use your fist with the thumb inward and the other hand on top, just as you do with abdominal thrusts, but put your fist on the same site where you would perform a CPR compression. Continue using one or more of these techniques until the obstruction is relieved or the patient becomes unconscious. When you practice these techniques, be sure to simulate thrusting. Never perform thrusts on a person who does not have an obstructed airway. If a responsive choking patient becomes unconscious while you are trying to help, carefully help the unconscious patient to the ground. Next, activate emergency medical services and immediately begin CPR, chest compressions. The compression should dislodge any obstruction. Following the chest compressions, you should quickly look inside the patient's mouth to see if there is any solid material visible in the airway. If an object is seen, you should remove the object with your finger. If no object is seen or the object has been removed, you should proceed with 2 rescue breaths. Finally, continue to give 30 compressions followed by attempting 2 rescue breaths, just as you've already learned. Continue CPR until the obstruction is relieved and the patient becomes responsive or emergency medical services arrives.